Menopause describes the biological stage in a woman's life when periods stop and they can no longer get pregnant naturally. This happens because the ovaries produce lower levels of hormones in the body. Most women usually experience menopause between the ages of 45 and 55, but it can occur earlier or later. Menopause can also occur for other reasons, including after removal of the ovaries or womb, following some cancer treatments like chemotherapy, or due to genetic causes. The term menopause technically refers to the time when periods have stopped for 12 months. However, symptoms usually start months or years beforehand, more accurately called perimenopause or the menopausal transition. Symptoms can last from months to several years and can change over time or persist beyond the menopause. Some people experience few, if any, symptoms, but for others, they can have a significant impact. Symptoms include a sudden feeling of warmth spreading through the upper body, known as hot flushes or flashes, night sweats and disturbed sleep, changes to your normal pattern of periods. In those taking hormonal contraception, this might not be noticed. Low energy levels, feeling the heart flutter, known as palpitations, headaches and migraines that are worse than usual, changes in body shape and weight gain, aches and pains in the muscles and joints, dry and itchy skin, low libido or sex drive, vaginal dryness. Common mental health symptoms include low mood and being anxious or irritable, impaired memory and concentration, known as brain fog. So, how is the menopause diagnosed? A doctor can usually make the diagnosis based on the history of symptoms. A blood test is usually not needed, but might be suggested if the diagnosis is unclear. How can symptoms be managed? Lifestyle changes that can help include stopping smoking and reducing alcohol and caffeine intake, as these can trigger hot flushes. Regular physical activity, which helps to relieve stress, strengthen bones, and keep the heart healthy. Relaxation techniques such as yoga to help reduce stress levels. Getting plenty of rest and a regular sleep routine. Wearing light clothing for hot flushes. Eating a healthy diet. Getting vitamin D through sunlight and supplements to help protect against weak bones. Improving heart health, for example, by controlling blood pressure and cholesterol. One of the most common ways of managing symptoms is by taking HRT, or hormone replacement therapy. But what is HRT? During the menopause, levels of the hormones estrogen and progesterone fall. Replacing lost estrogen is the main aim of HRT, as this helps to relieve menopausal symptoms. It also helps prevent osteoporosis, or thinning of the bones, which is more common after the menopause. Estrogen comes in patches, gels or sprays to put on the skin, or tablets. In people with a womb who are taking estrogen HRT, progesterone is also given to protect the womb lining. This is called combined HRT. Progesterone can be given as patches, tablets, or a progesterone intrauterine system, a small device inserted into the womb. For those with low libido despite treatment with HRT, testosterone gel might be suggested. The risks of HRT are small and usually outweighed by the benefits, but HRT may not be suitable for everyone. A family doctor can help provide more information about HRT and the risks and benefits. It is important to note that HRT is not a form of contraception, and a doctor will also be able to advise about suitable contraceptive methods. Are there any alternatives to HRT? There are medications that help with hot flushes, and antidepressants are sometimes used for low mood or anxiety. Cognitive behavioral therapy, or CBT, is a form of talking therapy which can also help. Alternative therapies such as herbal remedies are also available. However, the evidence of these is limited, and it is important to talk to a doctor before starting any complementary therapies. Going through the menopause can have a big impact on daily life, work, and relationships, and it is therefore common to feel low and anxious. If this is the case, it's important to let your doctor and loved ones know. Charities and patient support groups can provide more information and support, both in person and online. So, while the menopause can be difficult to go through, there are many treatment options and sources of support available to help people navigate this period of their lives and feel more like their usual selves. We hope this health sketch has been helpful to you and those around you. HealthSketch. Health for all to see.